Hi, good evening, everyone. I can see several people joining us. My name is Janelle Wortman, and I am the clinical pharmacist here at Summit Pacific. I work up on the third floor of the Wellness Center with the rest of the providers here in Elma. I see patients one-on-one up in the clinic and help them manage their medications. Some of the other things that I do are educational talks to our providers, and tonight I have the pleasure of speaking to you guys, our community. As you can see from the screen, tonight we're going to be talking about over-the-counter medications. I think that there are probably many times that we have walked into pharmacies and been absolutely overwhelmed by the amount of medications that we see on the shelves. And it is incredibly difficult to make heads or tails of what the medications are, what they do, the safety regarding the medications, and ultimately which ones we should be picking up off of the shelf to bring home with us. So we're going to spend some time tonight to unpack some of those things and help give you guys tools so that you feel more comfortable and confident going into the pharmacy and picking out over-the-counter medications. And there is a variety of different types of medications that you can buy without prescriptions for a variety of different needs. And we could probably spend entire evenings talking about each one of these individually. But I've picked out some of the most common types, most common things that people tend to go to the over-the-counter section for. And those are cough and cold. We'll talk a little bit about allergy, followed by pain and fever. And then lastly, we'll look at constipation and heartburn. And as we go along in this presentation, you guys can feel free to either ask questions or type in the chat as well. And I will try and keep an eye on that and ask questions answer questions as they come up. Before we dive in to the different types of medications, if you guys come away with anything from this evening's talk, I want it to be some important OTC, which is short for over-the-counter, so important OTC safety reminders, and just some general tips. Because there's a lot of medications to remember, and I don't expect everyone to remember all of them, but if you can remember some of these safety things, that's going to put you in a really good spot when you're going into a pharmacy looking for meds. The first one is always tell your healthcare providers what OTC medications you're taking. It's important to remember that just because a medication is for purchase at the pharmacy without a prescription doesn't necessarily mean it's 100% safe. So it's really important that your doctor knows what you're taking and why you're taking it. It's also very important to follow up with your PCP or primary care physician if your problem continues despite 1 to 2 weeks of OTC medication therapy. We all know sometimes minor small things happen and we can hop over to the pharmacy, grab some medications, and it resolves pretty quickly and we're feeling better. But if we are finding that after 1 to 2 weeks, the problem either isn't getting better or it's getting worse, then that might be time to go talk to your doctor because there could be something else going on. Sometimes when we're not feeling well, it's a symptom of something that's much bigger. So what we don't want to do is mask those symptoms with medications that we're buying over the counter. We want to make sure that we're listening to our bodies and checking in with our PCP so that they can see whether or not they need to dig a little deeper. The next one here is if you have liver or kidney disease, always check with a pharmacist or your PCP to make sure a medication is safe. Medications are either cleared through our liver or our kidney. That's how our body gets rid of them after we take them. So sometimes if our kidneys and our livers are not working up to par, then medications can go in our system. There are also some medications that can harm our kidneys and our liver. And if our kidneys or liver are already weak, then we might want to avoid those medications. So always just check in with a pharmacist, let them know what issue you have and if they think medication would be safe for that. And if you absolutely want to make a pharmacist day, you can even bring in copies of some of your last labs for them to see, so they can see the extent of your kidney disease or liver disease. And lastly is that it's very important to follow the directions on medication labels or boxes. The directions are there for a reason, and using more medication than what the directions say can lead to harm. So that's really, again, a safety reminder to always follow the directions on the box. And if you're finding that you're using the maximum amount of medication and you're still not getting any relief, that would be a time to reach out to your PCP. Now, these are some just general tips and tricks of how to find medications in the pharmacy and how to read labels. First one is, it's important to check labels for multiple ingredients. I would say a very, very large portion of medications that we buy over the counter have multiple different medications inside of them. And it's important to really only take what you need. If you only have a cough and nothing else going on, you probably only need a medication for a cough, not a medication that has a cough medication in it and 3 other medications for other things that you don't need. So I'll pull up these pictures and you guys, I'll give you a moment to look at them and look and see what differences you can find. At first glance, they both say Chlorocidin and HBP, cough and cold, and the last one has flu tacked on there. So you may look at these and think that they're pretty much the same, but if you take a moment and read the fine print, you'll see that the medications inside of them are actually quite different. Both of them have dextromethorphan in them, which we'll talk about in a little bit for cough. The top one has chlorpheniramine in it, which is an antihistamine, and you can see it on there. But the second one doesn't include that, but instead it has acetaminophen and guaifenesin. So completely different ingredients, and really, depending on the symptoms that you're having, you may need just one of those ingredients. The second tip here is that similar products can have completely different ingredients. So you shouldn't buy something just based on the brand name alone. So this picture here is a good example of that. They look almost the exact same, but have different ingredients. And here's another example that sometimes marketers like to use a brand name just because it's familiar and people see it and immediately reach for it. But in this case, you might go to the pharmacy, see the name Sudafed, pull it off the counter and think that you are buying Sudafed. When in fact, you're actually buying acetaminophen, guaifenesin, and phenylephrine, which is a cousin to Sudafed, but it's actually not even the same medication. So you're actually not even getting the medication you thought you were, and you're getting a lot of extra things on top of that. Some additional tips is that you can buy generic versions of over-the-counter products to save money. So if your doctor tells you to go to the store and pick up some Tylenol, you don't necessarily need to buy Tylenol brand. You can get the generic version, which is acetaminophen. And generally, those are a lot cheaper and they work the same. If you have a question whether or not a particular generic medication is the same as a brand name medication, you can always just bring those boxes up to the pharmacy and ask the pharmacist whether or not they're the same, and they'll be able to tell you. Which leads me into my next point here is that if you don't know what a medication ingredient is, does, or whether or not you need it, just ask a pharmacist. That's really what they're there for. And I know, speaking from personal experience, we always enjoy the chance to walk out from behind the counter and help people pick out over-the-counter medications. So now that we have laid the groundwork for looking at OTCs, I'm going to go ahead and dive on into the different types. So first up is cough and cold. And I always like to take this opportunity to remind us to cough into our elbow and not into our hand whenever we're talking about germs. And I'm sure we've had plenty of that in this last year. Thinking about cough, there are two different kinds of cough. There's a dry cough and a wet cough. If you're having a dry cough, the medication that's best for that is called dextromethorphan. And what this does is completely suppress our cough, which, if we're uncomfortable and coughing a lot, is helpful. But if we have a wet cough, it's actually bad. Because if we have a wet cough, we have phlegm that our body is trying to get out. And what the dextromethorphan does is hold that all in. So if you have a wet cough, you really actually don't want to use dextromethorphan because you want to allow your body to naturally get rid of that phlegm. This medication can cause some drowsiness. So because of that, it's just important to be careful mixing it with alcohol or other medications that can also cause drowsiness. So what do you do if you have a wet cough, if you have phlegm that's coming out? In that case, you might want to reach for a medication called guaifenesin. What this medication does is that it thins out phlegm so that it's easier for us to cough it up. This is sometimes also called an expectorant to help get the phlegm up and out of us. It's important to drink lots of fluids to help with this as well. And depending on who you talk to, some people find that just drinking lots of fluid is actually just as helpful for thinning out their phlegm than it is for taking this medication. So if you have a wet cough and you want to avoid taking medications, making sure that you're getting the appropriate amount of liquid will do you lots of good. When we're coming down with a cold, oftentimes we find ourselves reaching for some herbal supplements to help. I think some of the most common ones that we see to help with boost our immune system are vitamin C, echinacea, and zinc. So I'm going to take a moment and go through each of these and very briefly about the evidence that we have for them or whether or not they may actually be helpful. First up is vitamin C. Vitamin C does actually have some evidence behind it that it slightly reduces the length of your cold, but it doesn't necessarily prevent it. So there's no reason to be taking vitamin C every day, but if you find yourself coming down with a cold, if you start taking it at high doses, about 2,000 milligrams a day, studies have shown that it may shorten the length of your cold. And it's important not to take more than that because 2,000 milligrams is already a pretty high dose, and more than that can cause some upset stomach. Echinacea is an herb that people use to boost their immune system. And the evidence shows that it might help prevent colds if you take it at the very first sign of symptoms. But I say here evidence is mixed, which is showing that some studies show it helps and some studies shows that it doesn't help. So that one is still up for debate. But because it does boost your immune system, if someone is taking a medication that suppresses their immune system on purpose, it's important to avoid this medication because it can counteract that. And the last one is zinc. Zinc might be helpful to treat colds, again, if you take it at the very beginning of your cold. So within the first 2 days, probably sooner the better. Zinc you do have to take every 2 hours or so while awake, which ends up being a lot of medications to take throughout the day. But if you are able to do that, it may help. And this tip holds true for not just these three herbals and supplements, but for all vitamins and supplements, is that it's important to look for one of these two seals on the bottles of your medications. One is USP and the other one is NSF. And essentially those are national bodies that help ensure that what's inside of that bottle is actually what they say it is. They don't necessarily say that the herbal supplement will work for anything specific, but you can at least know that what they say is on the label is inside the bottle. So I always make sure that when I'm making recommendations for herbals and vitamins, that they have that seal on it. Now, the last slide here for cough and cold is thinking about decongestants, because that is a very bothersome symptom when we are feeling sick. First column here on the left-hand side are our oral decongestants, and that's phenylephrine and pseudoephedrine. Now, phenylephrine, I will say right now, there's lots of studies that show us that phenylephrine is actually not effective as an oral medication, as a decongestant. When you buy this over the counter, it's generally marketed as PE. So if you look at the picture that I have up on the slide in the bottom right-hand corner, you can see it says non-drowsy nasal decongestant PE. And that means that the ingredient inside of that is phenylephrine. If you're looking for a decongestant and it's not behind the counter and you don't have to show anyone your ID for it, there's very good chances, and it says PE, very good chances that's phenylephrine. And as a tablet, it's probably not going to do you much good. On the flip side, pseudoephedrine, which the brand name that we always talk about is Sudafed, that is going to be living behind the counter. And generally, you'll have to show your ID for it because there are limits on how much we can buy in any given day or any given month. And this medication is effective as a decongestant, but it also raises your blood pressure and your heart rate. So if you have heart disease or high blood pressure, it's not a good medication choice, and it's also not a good one to take every day. If you find that you have chronic inflammation, that you're always congested, there are other medications that are going to be better for you to use other than Sudafed. Now, if you don't want to take an oral tablet because you don't want to maybe go to the store and show ID for pseudoephedrine, you can use nasal decongestants, and all of these are all equally effective. You'll see that phenylephrine is also a nasal decongestant, and as a nose spray, it works a lot better than when we're taking it as a tablet. But any of these are perfectly appropriate. Some of the brand names you'll see are Afrin, or it'll say 12-hour nasal spray on the bottle. And these work almost immediately to help shrink our sinuses and allow us to breathe better. But along with that, it's important not to use them any longer than 3 days. If you use these medications longer than 3 days, it can lead to something that we call rebound congestion. And that's essentially when your nose gets addicted, more or less, to the medication. And if that happens, you do have to stop cold turkey and be congested for a few days, but it will get better. But to avoid needing to do that, it's good to limit use of those medications for no more than 3 days, just right at the height of, say, your cold when you're really needing it the most. And then going along with inflammation and maybe stuffy noses are allergies. There's a few different types of allergy medications out there. There are first-generation antihistamines, second-generation antihistamines, and nasal sprays. Our first-generation antihistamines are medications like diphenhydramine or Benadryl or Banafin, doxalamine. Now, I put chlorpheniramine on here. This isn't a medication that you'll usually see on its own, but it's often packaged in to a lot of those combination cold, cough, allergy products. So it's important to keep an eye out for that one because this entire class of medications can cause drowsiness. In fact, some of them are used to help people sleep. Along with that, they can cause blurry vision, dry mouth, and constipation. And if we are older, it can put us at increased risk for falling as well. So we want to be really careful with when we're using these medications and how much we are using. And it's important to tell your doctor if you are using them. Because we had so many issues with the drowsiness side effect of those first generation antihistamines, then we invented second generation antihistamines. And these are the non-drowsy allergy medications that we talk about so much. These are loratadine, cetirizine, fexofenadine, to name a few, which are the Claritins or Tex and Legras of the world. They are generally safe to use daily for seasonal allergies. They don't come along with a lot of side effects. So these are much safer to use every day than, say, a diphenhydramine. And the last group here are our nasal sprays. These are like fluticasone or Flonase or Nasacort, and they are steroids that reduce nasal inflammation. They don't work immediately, though. You do have to use them consistently for about a week before you'll start to notice a difference. So these are good medications to use maybe daily during allergy season, but they're not going to work as well if you're using them, say, maybe only once a week. You're probably not going to get the most benefit from them. It is important not to use them for longer than 6 months unless you talk to your PCP about it, and that is the plan for your treatment. Okay, and now we will move on to pain and fever. First up are our NSAIDs, or our non-steroidal anti-inflammatory drugs, but we call them NSAIDs for short. And this class of medication consists of aspirin and ibuprofen and naproxen. Now, I put some of the brand names up here just because oftentimes we'll use those names interchangeably, Aleve and Advil. But it's important to know, again, that you can use a generic version of the medication, like I have in the bottom right of the picture. Ibuprofen works the exact same as Advil. They're all 200 milligram ibuprofen tablets. Aspirin is an interesting medication because at high doses, so the 325 milligram dose, it's used for pain and fever. So in inflammation, it can work the same as ibuprofen and naproxen. But what we're probably more familiar with for aspirin is the low dose version of the medication, or the baby aspirin, as we sometimes refer to it as. And that's an 81 milligram dose, and that is for heart protection. So we have less heart attacks and strokes. The way that works is that aspirin blocks creation of a molecule that's needed to make clots and inflammation. And so because that's blocked, our blood gets thinned, which helps prevent heart attacks and strokes. However, ibuprofen and naproxen, although they're in the same family of medications, they're just different enough that they have the opposite effect on our heart health. So they reversibly block the same molecule. So aspirin does it irreversible, and ibuprofen and naproxen do it reversible. So that little bit of change of wording and little bit of way that they work makes it so that ibuprofen and naproxen also block creation of protective molecules. And because of that, it allows clot-forming molecules to form because we lose that protection, which then increases our risk of heart attacks and strokes, and can also increase our blood pressure. So if you have heart disease, you definitely will want to talk to your doctor about whether or not to take ibuprofen and naproxen, or how much. Thinking about the safety of NSAIDs, other than the heart disease consideration, is that all of them can increase our risk for bleeding, especially stomach bleeding. So if you have a history of stomach bleeding, would be a reason to avoid those medications, or at least talk to your doctor about it. These medications can also damage your kidneys, so you should avoid them if you have kidney disease. That being said, using a baby aspirin for heart protection is okay and won't have much of an effect on your kidneys. Because there are so many safety things to keep in mind for NSAIDs, the general recommendation is that if you're 60 or older, you should talk to your doctor before using them to make sure that your doctor doesn't see any reason to avoid the medication. And lastly, it's important to keep in mind that there are maximum doses of these medications. And when we're using them over the counter, the ibuprofen dose is 1,200 milligrams, so that's 6 tablets. And then there's a maximum for naproxen as well. And I put in bold here to not use them for longer than 10 days unless you talk to your PCP. The other probably most common pain medication is acetaminophen or Tylenol. And I also put the abbreviation of APAP on here, or APAP, because oftentimes that's how it's referred to in medicine, or you might see it on a prescription bottle where it just says APAP. That means it's acetaminophen. Acetaminophen works well for fever and general aches and pains, but it doesn't have any effect on inflammation. NSAIDs do the most for inflammation. Acetaminophen just works more generally than that. There are some safety things to note about it, though, is that there is a maximum dose of acetaminophen, and that's 3,000 milligrams a day. And when you're adding up the amount of milligrams that you've taken during the day, you need to take into consideration whether you have regular strength, which is 325 milligrams, or if you have extra strength, which is 500 milligrams. And if you go to your doctor and tell them that you're taking 2 acetaminophen tablets a day, they're probably going to ask you what strength it is. So that's something good to know that you can tell them as well. If you have liver disease, you should talk to your PCP about whether or not you should take acetaminophen. Sometimes you can still take it, but might just need to use a lower dose. And the last one here, I put in is do not mix acetaminophen with alcohol. What this does is that it increases a buildup of the toxic version of acetaminophen in your liver that causes liver injury, and it can be deadly. Acetaminophen is not a good hangover cure. You want to avoid that during and after drinking alcohol. And we'll move right along to constipation now. Before we jump into the medication, I want to put up a warning sign, in that there are some reasons that you should go see your doctor, your primary care physician, before necessarily going down the road of using medications for constipation. If you are having severe abdominal pain or cramping, fever, nausea or vomiting, blood in your stool, or dark or tarry looking stools, that's a reason to call someone. You may need to either go in to see your primary care provider, or depending on what their office says, may need to go to the emergency department. And if you're needing to use a laxative for greater than a week, you should probably talk to your PCP so they can see if there's something else going on. And again, before you reach for a medication, we should be thinking about if there are anything that we can do that's not a medication to help our condition. So in this case of constipation, we can increase fiber in our diet naturally just by eating more fruits and vegetables. We can drink more water, exercise, and the last one here is go when you need to go. When we are holding it in for too long, that can actually dry out our stool even more and make us more constipated. So try not to hold it for too long. And now we will move on to the medications. And there are a ton of different medications for constipation, and I am showing you all just 4 of them. And these 4 are generally the most common and also the safest for constipation. So if you're going to reach for one, picking one of these 4 is probably going to be your best bet. The first one of which is fiber, which we can get from our diet, or we can get in capsules, tablets, or powder formation. So those are like Citrusel, FiberCon, Metamucil. I have a couple generic example up there, as well as a brand name example. They all work the same. And because there are so many different types and names of them, if you go up and ask a pharmacist to help you find a fiber laxative, they'll be able to help you pick one out. Generally, fiber starts working in about 12 hours, anywhere up to 3 days. So Sometimes you have to have a little bit of patience with it. It doesn't work quickly, but it is really important to take it with a full glass of water. If we take our fiber tablets or capsules without water, it can actually cause blockages and make our constipation worse. So make sure you're having a full glass of water with that tablet. Next one on the list here is Docusate. Docusate is a stool softener. It does just that, softens the stool. And that works in a fairly similar amount of time. These are really safe, generally don't have a lot of side effects. On to our last two are polyethylene glycol, or the brand name for that is Miralax. What this does is that it keeps water in your stool and increases how frequently you have to go. It works in about 1 to 3 days. So again, not necessarily a fast-acting laxative. And it comes in a powder that you can mix into any liquid. And the very last one is probably the most different from the rest of them in that we call it a stimulant laxative. So those are going to be Senna, like the picture you can see on the screen, or bisacodyl. And they work a little bit more quickly. They work in about 6 hours to a day. So when you take one, you should probably get ready to go fairly quickly. And we call them stimulant laxatives because that's exactly what they do. They stimulate our bowels directly. For people who have chronic opioids, oftentimes those opioids can cause constipation because our opioids are actually stopping our intestines from moving appropriately. So even if our stool is as soft as could be, it just sits there. And what these stimulant laxatives do is kick that movement back into gear. So if you're on chronic opioid therapy, this is a good one for you, or for anyone who's finding that your stool is already soft. So say you're taking Docusate and you're taking fiber, your stool is soft, but you're still having a hard time going. Using a stimulant laxative may actually help get things moving through. Okay, which brings us to our last category of heartburn. As a pharmacist, my favorite thing to do is to have people not need to take medications. So we're always looking at things that we can do as lifestyle changes that may make it so we don't need to take medications or take as many medications. So some things that we can do for heartburn are, one, weight loss can help with acid reflux. Elevating the head of our bed can also be really helpful, especially for those of us who get acid reflux worse when we sleep at night. Chewing gum or lozenges can sometimes help keep acid down as well and prevent heartburn. But the big piece here for heartburn are avoiding triggers. All these different types of foods. Chocolate, peppermint, and caffeinated beverages can all make it more easier actually for acid and for food to come back up and cause heartburn. Acidic foods like sodas, orange juice, tomato sauce can trigger it, as well as high-fat foods. And you can see there on the slide, what actually happens is that when we eat high-fat meals, it slows how quickly food leaves our stomach. And because of that, our food sits in our stomach for a little bit longer and has a tendency to come back up again and cause heartburn. Alcohol and tobacco can also worsen heartburn for people. But say you do all of those things, you're avoiding your triggers, and your heartburn is still there. That would be a point in time to turn to some of these medications. The three main classes of medications that we have for heartburn are calcium carbonate, or Tums, H2 blockers is what we call them, or PPIs, which stands for proton pump inhibitors. But your PCP will likely refer to them as PPIs. Calcium carbonate, or Tums, work very quickly. They work within 5 minutes and last about 30 to 60 minutes. So those are best to take right before a meal that maybe contains trigger foods for you. So if you know that you're going to eat a meal or eat a really large meal and you'll have heartburn afterwards, taking it right before your meal will help cover you just for that meal while you're eating. The next class up are the H2 blockers. So those are medications like famotidine or cimetidine. Ranitidine was around for a very long time, but just a year or two ago, it got recalled from the market, and it hasn't made its way back to the market. But ranitidine probably sounds familiar to many people as well. Cimetidine you can buy over the counter, but it does have a lot of drug interactions. So if you do end up picking that one up, it's very important to talk to your PCP or talk to the pharmacist to see if there are any interactions with the medications that you're taking. Famotidine is a little bit easier one to use. It has less interactions. The H2 blockers, if you take them about 15 to 60 minutes before heartburn causing foods, they'll work the best. So they take a little bit longer to work, but they also work for longer. So they'll stay on board for about 6 to 12 hours, which is why sometimes people end up taking them about twice a day. The last class of antacid medications are your proton pump inhibitors, which are omeprazole and esomeprazole, or Prilosec or Nexium. They work best taking them, again, a little bit before a meal, so they have some time to kick in. And they work anywhere from 1 to 3 days. So they stay in your system a little bit longer to suppress the acid. There are a lot of side effects, though, that come along with the PPIs. So they're not good for long-term use unless you've talked to your PCP and you guys have decided together that that's the best thing for you going forward. But generally, when you're using them over the counter, keeping them to just a couple weeks is the recommendation before you check in with your PCP. And that concludes the portion of the presentation reviewing all the different types of medications. So as a quick summary slide, as I mentioned throughout the presentation, it's really important to try non-medicine options first. If we can avoid using another medication or purchasing another medication, that's always the best bet. If that doesn't work and we do decide to turn to a medication, make sure that you're reading the label for, one, the directions, but also the actual medications that are inside. And find a medication that only contains what you need. And if you have questions about what you need, you can talk to a pharmacist. Don't use a medication for longer than 1 to 2 weeks without talking to your PCP. And again, tell your PCP and pharmacist what over-the-counter medications that you take. When pharmacists are looking for drug interactions as well, when they're filling your prescription medications, it's important for them to know that you're taking over-the-counters. And lastly, when you need an over-the-counter medication, feel free to ask a pharmacist. That is what we are there for. But I do hope that you feel a bit more confident now walking into a pharmacy, being able to look at OTC medications and picking out ones that are the safest and best for you. So with that, I would like to open up to questions. If anyone has any, you can feel free to type them in the chat box, and I will do my best to answer them. And ultimately, increase your guys' confidence so that you can make sure that you are making your OTC choices count. Okay, and I don't see any other questions coming up in the chat box. Anyone who is still with us, that's the conclusion of this presentation. But if anyone does have questions, I will continue to stick around with the live stream open, and I'm happy to answer those. So thank you all for those who joined. And if you do have any questions, feel free to reach out to Summit and they can get you in contact with me.